So, for people who are joining the call, we're live streaming this on our YouTube channel. And at the beginning here, you're going to be on mute. But when we open the floor up for questions and a discussion toward the end, you should be able to raise your hand and unmute. But the chat is available. So, thanks everyone for taking some time out of your evening to listen to this discussion. We're really interested and excited to present all these amazing speakers. So as more people start to join in, I'll just start with introducing myself. My name is Teresa Homsey, and I'm with the Michigan Clinicians for Climate Action. And now we're recording, so we'll give it a couple minutes since we still have a ton of people in the waiting room. Okay, I'm going to go ahead and get started. I know that this is a topic that's of interest to people, so as more people join in, I'll just get started with a proper introduction. Once again, my name is Teresa Homsey. I'm with the Michigan Clinicians for Climate Action. And for people who are new to our organization, I just wanted to describe a little bit about our work. So we represent 450 Michigan health professionals. These include nurses, physicians, public health officials, mental health specialists, and our general mission is to advocate for decarbonization and electrification with the framing of climate solutions as health solutions, not only recognizing the immediate health impacts posed by fossil fuel pollution, but also the long-term health impacts. And given that we're a membership-based volunteer forward organization, you can join our professional network. If you're not already a member, you can scan this QR code to register. And we just ask for a small self-elected due. So we have suggested levels for giving, but you ultimately set your own rate. So that's our idea of making sure that membership is inclusive while also making sure that our organization reflects the interests of our members. And if I'm going to drop that link, yeah, Nyana's dropped that link in the chat. So let me know if at any point you have questions about what it means to be a MICA member or how to register. We also have links there where you can, if you're representing an institution, become an organizational member as opposed to an individual health professional member. So with that, I'm going to turn the floor over to our first set of speakers. I'm excited to introduce Prit Patel and Sneha Sundar, who are two med students, and I'm going to stop sharing my screen so that they can share their presentation.
All right, is that sharing right now?
Yeah.
Gotcha. Okay, so hi everybody. We'll be presenting AI data centers and what can we do. So my name is Prit Patel. I'm a second year medical student here in Detroit.
And I'm Sneha Sundar. I am a third year medical student at Michigan State College of Osteopathic Medicine in the Detroit campus as well.
Oh, and I go to Wayne State, by the way, but here we can get started. So we don't have any disclosures relevant to this presentation or topic.
So, kind of to start off, we're highlighting data centers because the AI systems themselves depend on this physical infrastructure, and it's not just software. There's physical infrastructure that is the data centers that support these AI systems. And data centers themselves have been kind of recently getting into the news, which is why we kind of wanted to focus our project on this and see how this impacts the local health of the communities they're being placed in. So data centers themselves, which we'll get into, but they require a lot of electricity, water, land, and cooling systems. And as this AI expands and other technological services, the communities that these data centers are being placed in are increasingly affected where this infrastructure is built. So what we wanted to first do was kind of highlight a recent example in South Memphis to show what in real time kind of what's been happening.
All right, so I just want to give a brief story about Memphis, Tennessee before we really get started. So back in 2023, Elon Musk founded xAI. So this is a company which is focused on building a lot of different advanced AI systems. And one of the main goals that Elon set out with this company was to compete with OpenAI, Meta, and Google with their chatbots. So in order to do this, however, he needed to build a new data center to essentially run this chatbot as soon as possible, right? He wanted to compete as soon as possible. So normally it takes about 18 to 24 months to build a major data center, but Elon Musk, especially xAI, did not really want to wait this long. So instead, they had to take a bunch of different shortcuts to do so. So they repurposed an existing abandoned factory. They compressed the entire planning timeline from a couple years and just down to a couple weeks. And they also did a lot of their construction in parallel with the hardware and the software setup. This would normally be done sequentially. And they also partnered with companies and manufacturers like NVIDIA and Dell to fast track a lot of the access to GPUs and servers, something that would normally take a couple years or months to do so. So what resulted was essentially one of the largest AI supercomputer facilities in the entire world that is responsible for the chatbot, I'm sure many of you are aware, but Grok, which is essentially Twitter's AI chatbot. And this facility was called Colossus, and it was built in South Memphis, Tennessee. And it's really important to realize that the fast tracking that they did enabled them to essentially build all of this without the residents having any say or any stake in this decision, right? They didn't have any say in the actual construction of this project. So really, this is not just a story of innovation in AI, but it's almost a story emphasizing how quickly these projects can move and how little time the communities around them have to react to them. All right, and this is just a brief photo of what the center looks like. So this is from May 2025 of last year, and this is about 0.4 square kilometers. And this entire project went from May 2025 to July 2025. So about 3 to 4 months to complete an entire data center. Right. And then on this topic of how big this data center is, obviously it's going to require quite a bit of power, right? So on this topic of fast tracking as well, in addition to what power they secured from the city, it was about 150 megawatts. They also brought their own gas turbines, so about 35 different mobile natural gas turbines on the site, which together generated around 420 megawatts of electricity. So it's quite a bit of electricity, right? 420 megawatts is enough to power 300,000 homes. And to put this into perspective, Memphis, Tennessee has 250,000 homes. So what you're essentially doing is this one project is essentially doubling the electricity usage of Memphis, Tennessee. And naturally, looking at this usage, you want to consider how exactly is it impacting everyone around these centers, the rest of Memphis. So in addition to rising utility costs, according to many environmental lawyers, many of the gas turbines that were creating and producing this power, they were actually built and implemented so quickly that they operated without many of the permits and regulations and the pollution controls adhering to the local laws in Memphis. So for the surrounding community in Memphis, the question isn't really like, should we use AI or not? It's almost like, how is AI impacting my day-to-day life, right? How is it impacting my air quality right outside my neighborhood? So one of the things I want to focus on is these gas turbines, right? So one of the things many residents living nearby reported was strong gas-like odors, similar to gas leaking from a stove coming from the gas turbines. And just focusing on these gas turbines, they emit a couple different pollutants I want to highlight. So things like nitrogen oxides, formaldehyde, and fine particulate matter. So these pollutants have known links to different health conditions. So nitrogen oxides, for example, they are linked to respiratory conditions. Formaldehyde, increased cancer risk. Fine particulate matter, it can get in your bloodstream, and there's been links to heart disease. So you already have a community, South Memphis, that has some of the highest asthma rates in Tennessee, and you're introducing a new facility that is almost exacerbating a lot of the health conditions residents are facing, unfortunately. And on top of that, this is a fairly marginalized community living in this area, so you almost have a question of environmental justice at this point, right? So it's really important to realize that Memphis is just one example. As AI continues to expand, the infrastructure powering it needs to expand. So the data centers, the cooling plants, all of them need to grow rapidly as the demand expands. So this really just illustrates that AI isn't something that's up in the air. It's something actually physical that people are directly affected by, unfortunately, right? And as a result, we'd like to talk a little bit more about these data centers in general and what exactly are they?
Yeah, so to kind of break this down, I think, like we've been mentioning, data centers have kind of been in the news as of lately, and I think it's important for all of us to understand what a data center is so we can better have evidence and support what we're kind of talking about. So to break it down, data centers are centralized facilities that house servers, storage, and networking equipment. Basically, what they're used for is processing, storing, and distributing large amounts of data to support online activities such as cloud computers, modern internet usage, and e-transactions. Some of these data centers can actually hold thousands of physical servers, with some facilities containing over 120,000. They have existed since technology has existed, but because of the increase of artificial intelligence and other online aspects, increased use has been occurring as this integration is occurring. AI itself relies on such a large swath of data to ensure its validity and to ensure that it works. And this swath of data does require a considerable amount of energy for storage of the data. So data centers themselves in the past year have consumed about 415 terawatts of electricity globally in 2024, which is roughly, if we were to put that into numbers, 1.5% of the world's electricity used. So why are data centers growing? In general, as I was mentioning, the age of the internet and technology has been increasing. So many of these services require data centers for support. I mentioned like big data analytics, e-commerce, machine learning workloads, and AI. As this increase of AI integration and reliance on cloud computing and internet services has occurred, this has kind of increased the uptake of data centers. And businesses and companies like the big companies are really seeing how there are an increase in data centers and are trying to capitalize on this push of AI. And there is interesting literature to kind of say that it might be like a chicken and egg problem. Are we actually is there actually too much data where that's why we need to create data centers, or is it the reverse where we're creating data centers to make money and then try to fill data in these data centers? So it's kind of interesting to see that the rise of the data centers might not actually be necessary, which is kind of why we wanted to look at the project, but we had this project and see what is it doing to the communities they're being placed in. The uptick of data centers also seems to be correlated to increased financial gain. This is like monetarily and also through data, as data kind of seems like the new currency. If we were to compare it to politics, data can actually be mapped, right? And politicians can kind of see what and the political landscape can see like where the data is mapped across the country. So it's kind of interesting to see what data centers can be used outside of artificial intelligence. So in terms of what we wanted to focus on, when we're looking at the environmental footprint of data centers, first we wanted to focus what we found out was the energy consumption with these data centers. So the energy required to keep these centers from shutting down translates to about 1 to 1.3% of global electricity consumption. So this transition integration has actually increased electricity from 1.8% to 4.6% since 2018. And electricity doesn't come out of nowhere. It requires fossil fuels. To support the energy demand, 56% of the power came from fossil fuels, producing more than 105 million metric tons of CO2 emissions. Many of these data centers additionally require on-set diesel generators for backup power, which contribute to emissions. I saw in the chat about cryptocurrency, so that does count in like that e-transaction because it does require a data center to kind of power that up and keep it online. In addition to energy consumption, we also have water consumption. So for some of us who are on social media, there has been and some media about how data centers are usually using water, and the way that they're reliant on water is because the cooling systems themselves need water to cool them down to make sure these systems don't burn over or overheat. In addition, these data centers are built on water, so they're using those natural resources and potentially polluting these waters. In fact, the cooling servers and data centers are projected 4.2 to 6.6 billion cubic meters of water withdrawal in 2027. So when we're looking at this existing research, much of the literature kind of focuses on the energy consumption modeling and also the efficiency of these data centers. I think the aspect that's rightfully being addressed is how can we make this more environmentally friendly, if there even is a way, and I think that's what big tech is kind of trying to kind of do. But when we're looking at the research, we weren't really seeing how these data centers impact the communities that they're being placed in. It seems that this research is really trying to address the energy consumption for optimization versus the individual people that are getting affected by the emissions and noise pollution and other things from the data centers. So why does this matter for communities? Why are we trying to focus on communities? Is because there are many ways these communities are burdened by these data centers. We did bring up the energy and the water. So, for example, a lot of the local residents are fronting the bills of the electricity versus the businesses that are putting them there. But in addition, there's also some noise pollution from how loud it is. There's a lot of exposure from the emissions like asthma, which can contribute to asthma, like cardiovascular disease, pulmonary disease. So these exposures can kind of compound the health burdens on already vulnerable areas. I know we mentioned Memphis, but something dear to both of us is we live in the city of Detroit, and Detroit actually has, I think many of you know, like some of the worst asthma rates, especially in children. So for placing these data centers, and for example, Ypres Landing, which was proposed, what is it going to do for the communities nearby? And again, for us clinicians or for us future clinicians, like how is it going to impact the people that we want to be our patients, basically?
All right, so just to go off of that very quickly, I just want to highlight the small study we did with Michigan that we presented earlier at MICA a couple months ago. So we've seen that a lot of the prior literature is pretty limited in how the actual people surrounding these data centers are affected, unfortunately. So it's something we wanted to try to address, especially right here in Michigan with the new center in Ypsilanti that Sam was talking about. But also, I think I read I think yesterday, that they'd like to build a center in Detroit, in the east part of Detroit, in an empty lot. So just a lot of things to think about that are kind of prompting the study, unfortunately. So we really focused on three main questions. So are Michigan data centers disproportionately situated in these socially vulnerable communities? Are environmental exposures and power plant emissions, are they higher near these data centers? And then how do exposures and emissions within Metro Detroit compare to outside of Metro Detroit? So we utilize a couple different publicly available data sources. So for facility locations, there's actually an open source list of data centers that is fairly limited, but it's one of the only things that is like publicly released that's free, as well as the Peering database, which is a government database that has data center locations on it. So we found about 41 centers in Detroit. And we also utilize data sets from the EPA for demographic characteristics, environmental exposures, and power plant emissions. So using all this data, essentially, what we did was we took each facility, we mapped it onto a mapping software known as QGIS, and we created a couple different distance buffers around them. So at 3, at 10, and at 20 miles. And essentially what we did was we looked at each of these variables and averaged them at each buffer. And we wanted to see, are any of these variables, are they disproportionately higher closer to data centers, for example? And just for a quick visualization on what this looks like. So you can see the different buffers here, so 3, 10, and 20 miles. And then everything in green, these little tiny dots, those are data centers and their connection facilities. And in pink, those are the power plants, right? So I'd like to walk through what we found with our study. I'm going to split it into 4 different key findings. So the first key finding that we had was we saw that community vulnerability is concentrated near facilities. So what this means is many indicators of what makes a community vulnerable, things like poverty, unemployment, even disability status, and percent people of color. We saw that these values were highest next to where these data centers are sited. And we even saw populations like populations under 5 and over 65 were the highest next to these data centers. Whereas other things like low income status or educational attainment, we saw that was like fairly high at an intermediate level and both of them ended up declining with distance. So all these would indicate that the population nearby these centers must be more vulnerable. And then, there we go. And then we also saw that local existing pollution burdens. So a lot of pollutants are concentrated near these facilities. So we're seeing things like fine particulate matter, diesel particulate matter, even nitrogen dioxide. A lot of these are highest closest to these data centers, unfortunately, and they end up declining with distance. So a lot of these we mentioned earlier, these have direct links to human health. Fine particulate matter with heart disease, nitrogen dioxide with a lot of respiratory conditions. And we're also seeing a lot of local infrastructure that's concentrated near these data centers. So a lot of like traffic, proximity, how many people are going by in cars, hazardous waste treatment plants and disposal facilities. A lot of these are concentrated next to these data centers. And we're also seeing kind of the opposite pattern with some other variables, things like ozone, older housing status, Superfund sites. So it's kind of a mix of what we're seeing in terms of relationships. And very similar with the power plant emissions, we're seeing these increase regionally. So what that means is we're seeing a lot of power plant emissions increase as you go away from these data centers. So that's something that really just tells us that a lot of this is attributable to siting. And we actually didn't see a difference even when we adjusted this for population as well. And then one last finding that I'd like to talk about is Metro Detroit facilities. We saw a lot of stronger proximity-based disparities compared to outside of Metro Detroit. So Metro Detroit is defined as this area shaded in red by the US government. And essentially what we did was we compared everything inside this little bubble to everything outside. And what we saw was kind of in all categories, Metro Detroit had a significantly higher community vulnerability. So we're seeing higher demographic indices, racial composition with more percent of people of color. We're also seeing more environmental exposures, things like fine particulate matter. Everything is significantly higher near these Metro Detroit facilities, unfortunately, right? So what that really tells us, what we're seeing here is that data centers are already expanding into communities that are already vulnerable at a baseline level. So as new infrastructure gets created in these areas with increased demand for AI, it's important to realize that this will most likely only end up deepening and unfortunately worsening the inequity we're already seeing. So we briefly discussed what kind of health impacts the emissions from the gas turbines can have, but we'd also like to talk some more about the health impacts in general that nearby communities may be susceptible to next to these data centers.
So I'm going to kind of start like top to bottom. So just in general, like overview that the industrial and energy related exposures like can affect multiple organ systems. So for example, if we're going to look neurologically, for pregnant patients, this can affect the fetus's neural tubes. There could be neural tube defects. Cardiovascularly, pollutants like PAH are associated with diseases like hypertension, atherosclerosis, and increased heart disease mortality. If we're looking at the respiratory system, there's higher rates of asthma, COPD, reduced lung function, specifically near those combustion-related exposures. And then in the reproductive tract, that were kind of there could be some like congenital heart issues, especially with the fetus. PAH is a specific pollutant that is I don't know the full word of it. I don't know if you can.
Polyaromatic hydrocarbons.
Yeah, perfect. Thank you. Those are produced and they can highly affect the human body because of the way the chemistry of those pollutants are involved. So for why this has become a policy issue, there has been a great push for these data centers to be placed in communities with lack of concern for the local residents. I kind of want to highlight, for example, Northern Virginia. So Northern Virginia in the US has probably the highest population of data centers concentrated in that Northern Virginia area. So when speaking with the residents, a couple of papers have shown, and that when they were talking, the residents themselves were reporting a lot of side effects. So particularly, they were noticing that this noise pollution was really affecting how they were living, the electricity cost burden. So they're almost paying triple the amount they were paying before. And actually, in terms of their mental health, because of the noise, the pollution, the smell, all of these things combined, like actually had a lower outlook on life. They didn't feel as part of the community as they had felt before, because all they were seeing were these data centers, and they didn't really feel like they were part of that like neighborhood experience. Additionally, they were promised that these companies would be taking a brunt of the monetary costs, but later realized that they were the ones paying for the expense of these data centers. So instead of these false promises of how much these data centers are going to support the community, unfortunately, they were the ones having to monetarily take the brunt of the cost. Finally, one of the things that data centers, or the companies that like to put data centers, like to say is it's going to increase jobs. Unfortunately, these jobs are more automated. So yes, there are more jobs, but they're actually taking away from human employees. It's actually more automated. So there's a lot of myths that these companies like to put out about how data centers are going to support the community, unfortunately, but it really is seeming like it's taking away from the community feel and the neighborhoods themselves. So the increase of data centers is not only a technical decision that big tech companies should be the ones making. It really, we need to pay attention to these people who are directly impacted by the centers, and it could even be like me and you, as we live in Michigan. Many times the cost of these data centers are actually hidden. So what we're doing is we're trying to advocate for the need for more transparent, health-conscious siting policies. So what does better policy look like? Basically, we have a couple of things. So first, greater transparency around the energy use and local environmental burden. So some of these companies, like I was mentioning in Northern Virginia, are kind of hiding like what they're doing. For example, Amazon, they have so many sites, but they haven't published a lot of their data regarding what their data centers are producing and what the cost of their data centers are actually. And we need more considerations for the cumulative impacts before approving these new facilities. So instead of trying to rush it like they did in Tennessee, we really need more time to understand what these data centers can do and if they're actually beneficial at all. And our focus is to make sure that the communities are the ones who have a say in what's going on, rather than these companies who can kind of just pump it down and kind of move on. And I think in terms of this, for the people like us, we want to kind of emphasize that it's not this like invisible cloud infrastructure that's like magically powering our computers. Like, we want everyone to understand that it's real, tangible, physical centers that are supporting the technology that we're using, the AI that we're using, and in consequence might have impact on day-to-day life for people living around them. So this is kind of more of a positive story. We kind of wanted to not just have some doom and gloom, but one of the examples that we wanted to bring up was in Monterey Park, California. There was a proposed data center. So kind of the story goes, like most data center stories, there was a quick like flyers and things into the community about a new data center that was going to pop up. And at first, the citizens didn't really know what to expect with this data center. They were given some flyers. It was a narrow time index. But as the time got closer to potentially establishing this data center, some local residents started to understand what was really going on and wanted to make a difference. So what they did was they rallied and they organized and they distributed a lot of flyers with information of what the proposed data centers were going to do. Because the data center that they had proposed was actually going to impact the health and environment of Monterey Park. So what they did, which we can go to the next slide, was they organized petitions, rallies, and community meetings and to ensure that all the citizens kind of knew what was going on and had enough information to make an informed decision. And these activists argued, like we've been saying, that the community should have a stronger role in these major infrastructures. So when the local government introduced a temporary moratorium on these new data centers, they put it on the ballot, and it got overturned basically. So this data center was not put in because of the local activists and people actually dispersing the information to the people regarding what these data centers would be doing. So here are some pictures about what that protest looked like. They were involved in the local government. They had a lot of meetings. And if you go to the next slide, there's some examples of kind of, might be hard to see, but there were just flyers on their website. If you scan the QR code, I think it's a great example of what a good website for dispersing information. So if people in the future want to have like kind of a background or like a framework to see what to build off of to help get like the citizens of our community to understand what data centers do, I think it's a great example. So if you see like what they say versus the truth, they're really trying to dispel those myths and make sure that all of the people involved and the community members really had all the information before they were kind of forced into something like the citizens of Tennessee were. So overall, if we're going to look at the AI infrastructure health and equity, these AI systems, like we've been saying, depend on large scale physical infrastructure. They're not just these invisible things that kind of happen. It's physical things that do require electricity and water. And this expansion as more technology like cryptocurrency and AI have been occurring, this involves energy, environmental, and again, impacts the community. So the infrastructure itself might already impact and kind of worsen the disparities that these local vulnerable communities already are facing. So we are trying to recommend or just say that we should have more insight into what these data centers are doing and also kind of understand what our role is in terms of AI usage and increased internet usage.
Yep, and I just want to add one more thing. So what we can really do is collective organizing and taking action into our own hands, right? That's what we saw in California, and I feel like that's one of the biggest ways if we're not able to rely on our lawmakers, our policy advocates, that we can do it ourselves, right? That's the biggest thing I'd like to take away. But yeah, and that's all we have. Thank you.
Thank you. If there are any questions, you can put it in the chat or unmute yourself.
Yeah, thank you. Great presentation, and I'm just going to jump in here and share in the chat a one-pager from the Michigan Environmental Council, which has some information about how data centers are specifically affecting utility rates and ratepayers. So I wanted to put that in there. But this was really helpful in the sense that I feel even though data centers aren't entirely new in terms of, the internet runs on data centers to some extent. Last year, it feels like a million different data center projects just came up overnight. So I checked, and at this point, Michigan has at least 74 data centers operational right now. But the Oracle OpenAI related digital project for Saline Township is the first one that is like a hyperscale data center. So that really, I feel like maybe changed some of the discussion from these being just like local projects that were, hyper local to a bigger, broader state issue. So I see some questions in the chat about whether or not the presentation and sources will be shared. Okay, we'll follow up with the attendee list for participants to check that out. And so we already got some questions here for people. Everyone is default muted, but if you want to speak your question out loud, you can raise your hand and we'll unmute you here. But we'll start with Hardeep Singh, who asks if you have any recommendations for what practicing physicians can do to reduce the carbon and environmental impact of AI other than advocacy and awareness.
So I think that's something we'll actually talk about in a little bit with some of the other speakers. But I think what we've been really thinking about recently is more responsible use of AI. I think unfortunately we don't as individuals, we don't have the most power. Like we can advocate like at our local organizations, but really it's essentially how can we limit our own use? How can we use it a little bit more responsibly and advocate for our colleagues to use it a little bit more responsibly? I think that's the biggest thing we can do on an individual level.
Yeah, I also just want to highlight the example, specifically what Britt was saying, with as I know some clinicians use Epic, and for example, there are like AI like generated things on Epic. So kind of echoing that responsible use of AI, which we understand AI is going to be integrated into society, and there are some benefits to it, but it's really that aberrant use of it that kind of takes away from some problem solving skills that we have, but also just randomly using it for, if I were to use a silly example, like random like AI generated cat videos, like we don't really need that. I think it's kind of ensuring that the way we're using it is as a tool versus as a crutch.
Yeah, and since you brought up that that's going to be a topic in the next presentation, I'm happy to move it along. I just wanted to make sure there weren't any lingering thoughts from the crowd about what y'all had just presented. We'll also have some time at the end for questions. I did just get like a PM about whether or not data centers in Michigan contribute to the local tax base. I believe that's dependent on the project itself and what they're promising, their city or township or county board. But I believe that Michigan did enact a sales tax exemption on larger scale data centers. And right now there's some legislation to try to repeal that tax, um, uh, repeal that sales tax exemption. So with that, I'm going to pass it over to Dr. Manny Berenji, who will present more about AI's usage and some of the context there. And yeah, great. Thank you, Dr. Berenji, for plugging your document there. I was going to share
Yeah, I
that in
just
there
wanted to
as
make sure I
well.
didn't forget. Nice to be with you all. I see some friends in the audience. My name is Manny Berenji, and I actually went to the University of Michigan for my preventive medicine, internal medicine residency program. So Michigan is a near and dear place to my heart. I'm so glad to be with you guys tonight. So let me go ahead and share. Alrighty, can you guys see?
Yes.
Excellent. Let me get this into presentation mode, and yes, we can go ahead and get started. So I wear a lot of different hats, as you can see here, but my biggest pride and joy right now is being the chair of the Climate Health and Informatics Working Group with the American Medical Informatics Association. I see some of my colleagues are on the call, and we're actually really trying to be at the forefront when it comes to being able to use these technologies in a responsible, environmentally conscious manner. I'm an occupational and environmental medicine physician, so this is something that I really care about, and I want to make sure that we can use these technologies for good. So I do work at the VA, so I had to make sure I put this disclosure. The presentation I'm giving tonight does not represent the view of the US government. No financial disclosures pertaining to this topic. So I'll let you guys take a look at some of these learning objectives. Really the goal tonight is to look at the current evidence base when it comes to how we can actually sustainably advance health AI using some evolving frameworks that some of my peers have developed in the last few years. And really trying to be at the table where these conversations are happening. I know that I'm currently in a position where I'm trying to leverage these AI tools for patient care. I do see the promise of these tools to be able to help with our patients, making sure that they get what they need. But looking at the trade-offs, especially from the environmental side, as our colleagues said earlier this evening, we have to make sure that we understand where this energy is coming from to drive these AI technologies. And I can tell you that over the last few months, I've really have been promoting and educating my fellow peers in the healthcare arena about some of these implications. And honestly, many of them don't really understand a lot of the environmental costs that are associated with scaling these AI technologies. So I've really made myself a champion of really awareness in the hope that we can help guide our clinical leadership to understand some of these nuances and really start to take that into consideration as we're scaling these technologies enterprise-wide. So the World Economic Forum recently came out with this publication looking at the future of AI-enabled healthcare. Highly recommend that you all take a look at this because it really gives a strong foundational understanding of some of the potential uses of health AI. Everything from ambient AI scribes, which we're actually starting to launch here at our facility, to agentic AI. How can we actually use these technologies to better enhance the patient experience, reduce documentation burden for our clinicians who have been suffering for decades? So, I look at the trade-offs, right? At the end of the day, we want to be able to have these tools to better take care of our patients. I think many of us clinicians in the audience can understand that. But we really need to be more cognizant of some of the energy drivers that are going to be required to scale a lot of these technologies that we're talking about. So full disclosure, I do use Notebook LM and I try to be mindful of my use. I actually use Notebook LM to generate some of the images that you're going to be seeing tonight. I actually try to get some information from Google as to how much energy is being expended for each one of these images. And of course, they don't disclose that. But based on some of the literature review I've done, it can take anywhere from 0.2 kilowatts to up to 10 kilowatts per image. So again, I'm just trying to be mindful and really raising the awareness of the trade-offs again. But at least for this particular topic, I thought it would be useful to have at least one or two images to drive some of these points across. So I hope you will indulge me. So really what I want to get at here, and our colleagues had really described this very well earlier, the energy expenditures, these data centers that are popping up all across the country, they're going to take up to 12%, even more, of total US electricity consumption. The water usage, I'm sure you have been following this as well. 1 to 5 million gallons per day per data center. I mean, this is additive and really understanding a lot of those environmental drivers. And then also understanding how the AI is being used for various different functionalities. From some of the information I've been able to gather, up to 80 to 90% of AI's energy can be consumed just during daily routine use. So these are the things that we need to be cognizant of. There's been some literature in the last few years really looking at this intersectionality of AI in medicine and how do we actually pursue what we call environmentally responsible science. This is an article that came out from Gateney et al. Really highlights some of the, again, some of the calculations that we have to make as we want to be able to use this technology, but really recognizing some of these environmental implications. There is so much that AI can do, especially for predictive analytics, looking at weather patterns. Can we use this technology to inform our vulnerable populations about, up and coming weather events? But again, this whole concept of trade-offs, understanding risk benefits, and again, having some of those quantitative capabilities to understand some of these nuances is going to be critical. This is an environmental scan that was done by Richie and colleagues. This came out, I believe, about a year ago or so. They actually did a scoping review of the literature just to see where the current evidence base is. As I'm sure you guys can probably, predict, there's not a lot of evidence out there. So it's imperative upon us, this community of interested professionals, to really help drive some of this research and really help to educate our peers within, the medical community and the greater community at large about how these technologies really need to be better understood and looking at some of the environmental impacts. I really love this Venn diagram that was in the Ritchie paper because to me, this kind of gets to the crux of the argument. We're looking at AI and all the potential benefits, and then we're also looking at environmental sustainability and ensuring that we can continue to deliver high quality care for our patients, but being cognizant of some of the the impacts that healthcare systems have actually had on the environment. You all probably know this statistic very well. Up to 8.5% of greenhouse gas emissions by US health systems, at least that's the last time I checked. I'm sure it's higher now, but 8.5% of greenhouse gas emissions in the US are coming from healthcare institutions. And I think recognizing that this number is actually going to increase should really be an imperative to all of us to continue to not only raise awareness, but develop systems that our colleagues in positions of leadership can use to better track the energy and water and all the various different components that are required to keep these AI systems running and making sure that we can be cognizant of the health impacts. I'm going to spend a little bit of time tonight talking about this framework. My colleague Chetan Surabu, who some of you may know, he is the Director of Clinical Innovation and an Assistant Professor of Medicine at Cornell. He's really been at the forefront of developing some of these discussions around how do we, sustainably advance this health AI technology in a responsible manner. And he and his counterparts at Cornell and Cornell Tech came out with this framework about 6 or so months ago. Highly recommend that you take a look at this because they were able to really start to quantify, some of these particular types of AI activities and start to come up with kind of a model, if you will, to be able to quantify some of the energy expenditures associated with the use of health AI. This is just a table from the paper. So they were able to provide an overview as to energy utilization based on specific AI models that are being incorporated into the healthcare ecosystem, starting with the development phase of the AI. They provided some granular examples and just looking at relative resource use. If you actually are able to look at that 6th column, they were able to come up with, again, a framing for how much energy is going to be required to be able to run these particular stages of AI development and further components of the AI technologies. So as you can see here, the development phase clearly uses a lot of resources. The training phase, this is where you're actually training your AI to be able to be ready for prime time, if you will. Again, a lot of energy resources will be needed to be able to do these types of trainings. And then lastly, you can see that the third row there, looking at this concept of inference. I don't want to get too technical here tonight, but what you need to know about inference is that essentially it needs to iterate and be able to respond to specific prompts. So this would be fairly low on the resource utilization spectrum. But again, we need to make sure that we're understanding that this is going to be used fairly routinely. So this actually would add up because of the number of inferences that would need to be performed for a variety of different patient-related functions. So what I really love about this framework is that they were able to use this case scenario. So they actually were looking at AI-powered patient messaging. So this is something that a lot of patients have really been gravitating towards. How do they actually interact with their health system? And a few health systems have actually already started to incorporate this technology within their patient portals so that patients can directly message their providers. So they actually provided these different scenarios depending on the particular nuances. So you can see here they have their base case, which is one clinical note using a GPT-4 model, and just having these kind of assumptions with, standard efficiencies and energy grid utilization. So they were able to come up with this framing. And, as they started to create more and more complicated patient messaging workflows, you can see that the amount of emissions started to actually decrease. So as you can see in option C, using a quote green data center, which utilizes renewable energy sources such as wind or solar or geothermal, you can see there that the number of yearly emissions based on this simulation actually decreased from the base case emission of 48,000 all the way down to 11,000. So really the basic gist of this slide is to be cognizant of how we can actually change the whole discussion by kind of incorporating some of these other alternatives to energy use. Can we use a leaner AI model? Can we actually start to, kind of be more creative with how we use the technology? So I think I might have mentioned this already, but a lot of the AI models' energy consumption is really coming at the inference stage. This is where it starts to iterate and responds to specific prompts. And as I highlighted in the previous slide, being able to really reimagine how we can use the AI technologies and taking advantage of some of the levers that we have can actually help reduce the amount of energy that would be needed to run that particular AI modality. Apologies again, I did use Notebook-LM to kind of illustrate some of these points that I'm trying to make. So really the basic essence here is to take advantage of these levers. How can we actually be more cognizant of what the AI is supposed to do? What kind of model do we need to use? And as our colleagues in the previous presentation alluded to, where is this energy actually coming from? I actually posed this question to some of my colleagues at a recent Health IT conference, during a reception, and no one could give me a real answer as to where the energy that they're going to be using to drive these health AI technologies, where is it actually coming from? So I think just being able to be, mindful, curious, and as an educator, this is something that I want to make sure that our peers understand. I think these are good conversations that you can have even within your own networks, your own specialties. I highly encourage you to actually start doing that. And I know I don't have to nudge you guys too much because you're here because you care about the subject. Again, just illustrating what I've already stated in the previous slides, being mindful of how we use the energy at specific times of the day. So if we're able to, find ways to do what they call this batching concept. So being able to do a lot of the high energy expenditure related crunching the later parts of the day into the evening and night, and just being cognizant of how much energy the healthcare system could save just by, making these small modifications. I think that's really going to be the ticket. If we can actually make that business case that, being making these types of decisions as to how the AIs are being trained, for instance, being able to look at some of these key metrics can actually save health systems money. So that's been a really provocative. It's actually not really provocative. It's actually business sense. How can we actually still do this work, being mindful of not only the environment, also savings. Everyone loves to save money, right? So that's been another lever that I've been able to pull in some of the circles and some of the discussions I've been having with folks in the upper echelons of the healthcare ecosystem. I promise this is the last one. So really looking at shifting AI workloads, being cognizant of where the energy is coming from, and again, talking to our colleagues who are in positions of influence, being able to share some of this information and relaying that doing this makes environmental sense and business sense. This is a paper that came out in the New England Journal, The Catalyst, about a year or so ago. And I really love this because it really gets to kind of the crux of how we can actually develop these tools in an environmentally conscious way. I've been very mindful of the current landscape that we currently live in, but I really strongly believe that this is something that everyone can gravitate towards, irrespective of where your fellow peers or colleagues may fall on the spectrum when it comes to the impacts of a specific, drivers of climate-related events. To me, this makes sense. And if we're able to relay some of these points about the impacts on communities, the impacts on people's health, people care about their kids. They don't necessarily want to be, next to one of these data centers turning 24/7. Can we actually do this better? And I think the answer is yes. We live in America. We've always been the drivers of technology, and I mean that's really what has made America so great. And if we can actually really band together to continue to drive technological innovation and ingenuity, I really think that we can tackle this crisis. This is another paper that I was hoping you would all take a look at by Fisk et al. Some of the challenges that we're facing in the healthcare arena when it comes to ethical AI. I know this for a fact because I've been involved in some AI governance discussions about how do we actually scale this technology, being mindful of the communities that we serve. So this is just another layer that we have to really be mindful of. And I wanted to conclude this presentation with this paper from our colleagues in Japan. They've actually done some pretty remarkable work in this space over the last decade or so. This was an excellent review paper that came out in 2024 by Ueda et al. Really looking at what these folks were able to do in the radiology space and how they were actually able to create specific workflows that were environmentally friendly. This is pretty much a basic summary of what the paper was trying to get at. Being able to again, being smart about how you're using the energy and when you're using it and for what purpose. I think there's such a drive right now to just scale and just put these tools into people's hands. Just taking that one moment to just pause and think about how we're going to use this technology and asking those basic questions that I just asked. A lot of times, you may not necessarily need to use the AI in the first place if you actually have a bigger issue that you need to solve. And many times in the clinical arenas, on the front lines, a lot of solutions actually come from improving processes and improving basic operational workflows. I know this because I've done this work. It's hard work. You can't expect AI to be the panacea to solve all of those problems if your underlying infrastructure is the problem. So I think being able to educate our colleagues to really take that step back and say, hey, do I even need to use AI in the first place? And if the answer is no, then get to your Six Sigma, get back to your lean management principles, and do the work to do it right. Get your processes in order. If AI is something that you do need to pursue, then this is what we need to drive home. Being able to use some of these frameworks that our peers have developed and being able to drive those conversations in your respective institutions, being able to be mindful of the energy costs. And this is going to be a really big ticket item, folks, because energy costs are going up. So if we're able to have those conversations now, I think this actually might be the right time to have them. And then really looking beyond sustainability and being able to, use these tools in ways that can actually save, the system money down the road. So that's where the AI can really be, it can actually help us. It can help us with our predictive capabilities, better resource allocation. How do we actually use our supply chains more wisely, being able to source locally. It all comes back to our basic principles of environmental stewardship. So what do I see on the horizon? I'm an optimist by nature, and I can tell you from my own experience, these conversations are resonating. And like I said, energy expenditures are going to go up just by virtue of what's happening around the world right now. People are really taking a second look at some of these other sources of energy. There's a lot of innovation happening, especially around ways to develop novel cooling systems so we don't necessarily need to use so much water. I mean, there's scientists out there right now doing this hard work to make things more efficient. So I want to make sure that we can continue to innovate, we can continue to inspire, and we can continue to influence our colleagues and peers in the health system to responsibly drive health AI in a sustainable way. And that is all I have. I appreciate your time tonight. Happy to take questions.
Thank you, Dr. Brenji. And I noticed that unless I missed it, I don't think you plugged your own paper in this presentation, did you? If not,
I just plugged the Climate Health and Informatics Working Group, but if you want to email me, I'm happy to have conversations with you all separately, and I'm happy to share. I mean, there's just so much I don't necessarily want to bog everyone down.
yeah, no problem. Well, I just dropped your article in the chat
Oh,
there.
thank you. Yeah, I appreciate that. I forgot about that.
Yeah, I would direct everyone to check that out as well. And as we wait for more questions to trickle in, Dr. Erin Miller, when you first got on, she asked for your elevator pitch when it comes to educating colleagues about the environmental impacts of AI when they're only considering the upsides of technology. And I know that you kind of addressed that in your presentation, but
Oh, yeah, no worries.
wanted to see if you wanted to elaborate more on like your elevator pitch. How do you talk about this with your peers in the
Yeah.
workplace in a more relaxed space as opposed to this kind of like webinar format?
Oh, no, absolutely. I think this is we might need to have a separate webinar actually on this subject because I think communication is so important right now. And at least for, my experience being on the conference circuit, costs, that is a big conversation starter. If you're actually able to come in and say, hey, look, like, do you know how much it costs to run this AI? No one has an answer. And I actually had folks who were emailing their administrators like, hey, what is this answer? Like, I have no idea what it is. So to me, that's been the greatest conversation starter because you're asking things that they don't know. And folks at that caliber don't want to be in a position where they don't know something. So kind of talking about these things at a casual like reception, just trying to pique their interest, build up that curiosity. Just asking like simple questions really gets people's juices flowing. And, I've had some people reach out to me afterwards and say, hey, look, I'd really like to learn more about this sustainable AI framework. Can you share your information with me? And that's kind of how it starts, folks. You got to start small, find those networks. Anything from even the medical school curriculum, like any of your events, have some of these ways to be able to talk to people face to face. It can be a little hard on Zoom, I'm not going to lie, but I'm a big proponent of, talking to people in person if you are able to, be able to connect with your peers and just start to build these conversations up organically from a place of, well intentioned. A lot of times people will at least give you the ability to have that conversation if your intents are really just pure. You really want to make sure that these technologies are going to be available for everyone, but we got to make sure that we're going to have enough, water. I mean, this is a huge problem right now in the Southwest. I mean, there's a whole discussion right now about who's going to get what from the Colorado River. So, these conversations are already happening because we are already in situations where we're facing some of these challenges. So just come from a place of curiosity, good intention, and start small, start with costs, energy costs. That to me has been the winning ticket, at least so far.
Yeah, that's sound advice. I'm gonna see if there's any other questions coming through. You can raise your hand and we'll unmute you, or you can drop it in the chat. Okay, Shelly. Um, I
Oh, hey, Shelley, nice to see you.
let's.
Yeah, thank you so much. I will go back and listen to the part that I didn't get. So if I'm asking you to repeat something you've already talked about, um, I've been really struggling with the magnitudes here. I'm somebody who likes to understand context and who really, I mean, I love your, like, how much does this cost? How much energy are we really talking about? How does that compare to the energy we're already using? And I have just found in the entire discussion around data centers and AI, the numbers are so, I want to say, gigantic that I keep thinking there is this like meteorite that's falling. I don't, I'm literally, it's disorienting and unsettling. So I don't know if you have a way that you're thinking about it, but for example, in New Mexico, we have one data center that's been proposed in a very a community that suffers from many issues related to oil and gas contamination and water, et cetera. And it is talking about using, I believe, if I can make sense out of this, like double the energy consumption that New Mexico already uses. I mean, it's just and $165 billion when our state budget is $12 billion. So industrial bonds over 30 years. So the context of all of this and the amounts of water, the millions and millions of gallons. So I'd love to hear how you think about uh, healthcare. On the one hand, we want to ask ourselves how to use it. On the other hand, we're also in a position to be advocates around greener data centers, et cetera. But how do we even talk about green when the scale is so huge?
Yeah, Shelley, these are great questions. And honestly, I'm just sharing what's been working for me so far, focusing on, the cost implications of, how much energy we're going to actually need, both direct and indirect costs. To me, that's been a great starting point because I think a lot of folks can understand, dollars. And then from there, I think I've been able to, start having those more nuanced conversations about, other resource expenditures, water, for instance. I know we're struggling with that in the Southwest. To me, we got to be able to focus on things that are going to matter to, at least in the healthcare ecosystem, the healthcare administrators, the bean counters, you know, I have friends who care about this stuff, but a lot of times they don't see the linkages. So to me, this has been that bridge. If we're able to actually relay that this is going to cost money, and are you guys actually thinking about that? We got to be able to go for that lowest hanging fruit. And at least in my view, that is the way to start. And then from there, we can start to have more intentional conversations about some of the, things that we all care about, the environmental impacts, the impacts on communities of color. I mean, these are things that I care about very deeply. I live in a community where, we're affected by all of these air contaminants. Data centers are now popping up in LA County. I mean, it's a whole thing. So, but at the end of the day, we really have to focus on things that are going to matter to a healthcare administrator. And these are things that are going to matter to them.
Well, we have some more time for discussion. I'm gonna pass the torch over to Dr. Erin Miller, who's gonna facilitate some, since we're already on the train of, balancing, I guess, the environmental concerns with some of the ethical and actual day-to-day implications. Dr. Miller, feel free to take it from here.
Thank you so much. And thank you so much to all the colleagues who have come before me. I've learned a bunch tonight. I'm very excited to kind of take forward some of those items into my practice. So let me go ahead and see here. Can you see my screen okay?
Yes.
Okay, perfect. All right. Is it in present? Hold on. Presentation mode. There we go. Okay. So I'm Dr. Erin Miller. I am a primary care physician in Detroit and the medical director of the Clinical Skills Center here at Wayne State University, where I fear I'm becoming the resident AI nag. Someone will bring up in a meeting, well, we could just get AI to do that. And I'll say, do we need AI? And so now people are just saying, like, Dr. Miller, close your ears. Let's get AI to do that. But it's very helpful to find out other people's strategies to, kind of bring up some of the negative impacts and in those professional discussions. So I really appreciated that. And my only disclosure is that I do too use AI. I think it can be a very powerful tool, but I'm advocating today for just a more intentional approach as we kind of have a discussion. So my objectives are here. I really want to describe what's out there as far as frameworks for considering ethical uses of AI in medicine, but talk about how the environmental impacts, particularly when we view it through a lens of health equity, complicate those ethical considerations. I also want to spend a little bit of time thinking about the promise of AI as a tool that can revolutionize our patient care delivery, our provider experience, but also view that within the larger goals of the American healthcare system, and kind of think about how that tension might play out in real life. And then it would be, I think, great if we could all kind of consider our own personal ground rules for engaging with AI in a more intentional way. So just to start, I wanted to bring this up. This is a module available through the AMA that helps to walk providers through their engagement with AI healthcare delivery tools and how they can do that in the most ethical way possible. I think it's excellent. It covers a lot of really valuable ground. And so this is just like a very quick summary, and it goes through these kind of 6 steps that you should use as your framework when you're about to start to integrate a new AI-based tool into your care delivery. And it goes through everything from considering the appropriateness to thinking about how you're going to disclose this use to your patients to how you continue to evaluate your ongoing use of the tool. It's wonderful. And I think there is a gap because it does fail to consider the environmental impacts of AI. And so that's, what I'd like to add. And if you look at the framework here, step number 2 is to evaluate the ethical considerations. And it says if the tool introduces inequity or risk, you should adjust, override, or avoid use and report. And so as I know Prit and Sneha kind of helped us to focus on earlier in the talk and their discussion of what's happening in Memphis, really the environmental impacts of AI are an equity issue. And so I think it fits nicely into this framework to, as you're considering using a new AI tool, really taking that environmental impact under consideration. So that brings me to my first slide of kind of conversation starters. And again, Prit and Sneha did such a lovely job of covering what's happening down there in Memphis and now actually in Mississippi, because the community was pushing back in Memphis. And so Mr. Musk and his team have just relocated a little bit south of the border in Mississippi for their second portion of the, the energy generation for their project. And so the fight continues. It's still going on in Memphis, and now it's also happening in Mississippi. So anyhow, my question to you is, like, how do we weigh those unequal impacts of data centers on different communities? Who is bearing the cost for our use of these technologies that make our lives easier? And is this just? So I guess I'll kind of stop there and open up the floor to comment. I suppose then maybe I can move on to the third question on the slide. And so how does this equity kind of concern impact your work in caring for patients? And how does it shape your advocacy going forward? These are kind of heavy questions, and at the end of a long discussion already. So if you're having a little bit of a hard time kind of pulling this together, I think what I would say to get the ball rolling here is, I think this needs to be part of the conversation. And I have many colleagues who are deeply committed to health equity and often running to AI as the solution for a particular tool. And so I think simply finding ways to gently introduce this, in a very kind of understanding and compassionate way to our colleagues that, this is not just a matter of ease. This is not just a matter of improving your own workflow. This has real world implications, I think is really kind of critical. Lisa, yeah.
Okay, I'm unmuted. Took me a second. Thanks for this discussion. Thanks to everybody. I love the questions that you pose, and this will show my ignorance because, one, I was not a patient-facing clinician, and two, I've been retired for a while. But I guess one question I would have is, when you work with Epic systems, my understanding is sometimes they can kind of provide little questions to you to think about or little clues. Is that correct? And if that were the case, would there be ways to kind of ask the question, how much particulate matter is this going to result in an adjacent, community, or some sort of flags that could be incorporated in an electronic medical record to create a situation in which people are taking a second and reflecting on the environmental impacts.
Yeah, I think that would be huge. And right now I'm thinking who would I advocate for and within our healthcare system that we try something like that, because it is true. It's, I already, as I'm going through, we use Epic in the healthcare system where I practice. And so when I'm responding to patients, sometimes it'll pop up with a little AI generated suggestion, oh, here, you can take this and then modify it and send it to the patient. I'm I don't really want that. I can do that myself. It will also generate a summary, which, can be helpful, where it will pull through the last, X number of notes and come up with a little summary for you of the patient. And I'm wondering, first of all, how we can offer people the capacity to opt out. They're now offering ambient listening technology, which will help you to write your notes, which I have not opted into, but, can we go further? Can we opt out? And then how do we also put the environmental impact kind of in front of clinicians in their day-to-day life? I think that could be very powerful. And I am seeing some more questions kind of coming through the chat. So I see here, it looks like Dr. Matthew mentioned, do we have a sense from softwares like Copilot and Gemini what the carbon costs are. Oh, based on the time spent to build the infographics. That I don't know if that's maybe a question for our last speaker or for me. I know that image-based generation is definitely more carbon intensive than just text. So it would be good to have some of those numbers. So, and I see Shelley with your hand raised. Shelley, do you have a question? Shelley, did you want to say something? I also see you have a comment in the chat here.
Okay, I'm sorry. You have to be allowed to unmute, so I was
Oh,
waiting for that.
gotcha.
First of all, I just think this is a fabulous conversation, and it's great questions. And I have to say, from my work with Healthy Climate New Mexico, we've been much more focused on, I guess I want to say, the upstream question of whether to build these things or not, and less focused on the user and I'm going to call it the individual personal responsibility questions that you're asking. So I just want to honor that. And I would guess, just took my 96-year-old mother to the primary care doctor who gave my mother a choice, right? Would you like me to turn on AI so that I can look at you and spend time actually assessing you instead of focusing on my screen? And for most of us, I mean, I'm on the other end, I'm not a clinician, but most of our experience in the last, 10 years of receiving medical care is never seeing the eyes of our clinician. So I'm not arguing for data center or AI use. However, I really do want to insert into this ethical discussion about both the potential benefits, as you mentioned, in terms of even the clinician's assessment and diagnosis and getting summaries, but also that patient, it was mind-boggling to me. This person actually looked at my mother for 15 minutes, and she would not have.
Yeah.
I have many clinician friends, and they spend a lot of time staring at their computer screen. So just want to add that in. And then in that larger issue around all the promises, I'm not saying they come through, but that's a big part of how the actual, production centers, the data centers are being promoted, is all the benefits to the community. I don't buy that, but I just want to say it's part of that larger conversation.
I so appreciate your comments. First of all, you reminded me I had a little disclaimer written down, which I forgot to say in my excitement to get to the questions. But that, yes, like this is going to focus a lot on personal responsibility, but obviously systems level changes are what's needed to make real impacts. And so I tried to build that in slightly in my kind of allusions to advocacy and what we can do collectively to shape systems level change. So thank you for reminding me to say that. And actually, your comment about looking your mother in the eye, which is so powerful, brings me to my next slide, actually. And so thank you for that wonderful transition, because I want to spend a little bit of time about the promise that AI has kind of been sold to us as, and really the true benefits that we might be able to reap from it, but also the system which is using it currently. And so I wanted to kind of just put out there that I have watched many colleagues embrace AI with open arms, with full enthusiasm, people who are very skeptical about the latest journal article and the latest changes to guidelines and the newest treatment recommendations, and who want to see the evidence and who want to kind of take a very analytical approach. With AI, it seems to be just like unbridled enthusiasm, which is so interesting to me. And so I think part of that is because many of us who are engaged in, a lot of patient-facing care feel like we're drowning, There's never enough hours in the day to see all the patients and respond to all the in-basket messages and return all the emails and the phone calls. And it's very overwhelming. And so the promise of AI is that it's this life preserver that we have when we're drowning, right? We can offload some of these more menial tasks. We can focus on the meaningful things. We can get back to the bedside. We can look people in the eye. We can spend time like really providing patient care, which is what those of us who provide patient care love to do. And so, of course, that promise is so alluring. And I just like, and I haven't found a good way to ask people this, but I think it can do all of those things. But when AI is fully integrated into our system, will that be how it's used? I just ask everybody to seriously ask yourself, like, has the American healthcare system, the same one that has all of us providers feeling like we're drowning, like really earned our trust that it's going to prioritize patient outcomes, that it's going to prioritize the patient and the provider experience? Or do we think it's going to prioritize something else? You know, AI can be a powerful tool for high quality healthcare delivery, and or it could be a powerful tool to maximize profit generation, right? And like, if we're being really honest with ourselves, where do we think all of this ends? And so I think as we're looking at AI and kind of, you know, just being so mesmerized by all it can do, we have to be realistic about the systems that we're operating within. So I just kind of wanted to put that out there, see if there are any responses. And think about how we can ensure that patient care really remains the focus when, you know, the push to maximize profits also exists.
Erin, those are such touching statements and so insightful and thoughtful. And thank you. And I think it really does drive home to the larger questions about providing healthcare and the fact that we're not doing it well right now in many ways, unfortunately, because of the limits that you described, and really going to the root cause, not just finding AI as a way to kind of move us past a critical moment in the immediate run. And with all the change, post-pandemic and considering, the Medicaid and the ACA changes, I think this really is the moment in which to ask the questions that you just put up, in a really deep way. And, talking about access to healthcare and should we be thinking about universal healthcare and or single payer, et cetera. So I really appreciate that you asked those questions. I also think that it goes potentially to the point of the upfront advocacy. If we say AI might be a tool that can help us interact in a more one-on-one way with our patients. And I agree, we really have to challenge that question and to know whether that really is the case. But let's say it is the case, then I think the upfront advocacy and setting the guardrails on the tech companies, on the data centers to insist that the tech companies are the ones that are paying for things, and to insist that they're forced to move away from fossil fuels as to power it, and to consider the water issues. I mean, they're extremely wealthy businesses and corporations that if we set forceful enough guardrails, it could spur innovation and creativity if we force them to do it. And so I think that's an argument for the upfront advocacy. So thank you, Erin, for your comments.
I have a question here, and I know we're approaching our last couple minutes. As someone who's not a clinician, but is very familiar with being a Google doctor, I know that it's a lot of people already turn to the internet when they have a health concern and want to learn more information. And I know that there's been more articles about how people are using ChatGPT in lieu of therapy or actually receiving real medical care. And so I could see there being some cynicism among the general public of like, well, why should I even bother going to the doctor if they're also using AI and I can just do that at home for free? And so I wonder if there's, I know that the AI systems that you use in the health setting are not quite the same as what the general public is. But how do you distinguish that and differentiate your expertise from what you're getting from one of these models?
I think that's such a great question. And I think it's going to become a more and more pressing question. One of the things I didn't put in here because I didn't want to seem like I was wearing a tinfoil hat was like, what are they doing with all this data, right, that they're collecting and how healthcare providers are engaging with these systems? And, like clearly they're probably, somebody out there is collecting data saying, these are the questions that the doctor is asking, and these are the answers they're seeking, and this is how they're conveying, like all this ambient technology, this listening technology, what's happening to that data. So I think that these tools are going to get more and more powerful over time, and it really begs the question then, like, what are us humans bringing to the doctor? I think in this moment, the technology is really still in this kind of nascent phase. And so there's a tool, the tool that I turn to more than anything else, AI-wise, is called Open Evidence, which kind of scours all the medical literature and pulls together answers for you if you have a tough clinical question. And it's a very powerful tool. But sometimes it's wrong. And sometimes I'll look at the answer it gives me and I'll be like, wait, that's not the right antibiotic dose. And I'll go to a different reference and I'll be like, yeah, this was the right antibiotic dose. So, it can be wrong. And so I think having that kind of human layer of expertise to check what the AI is generating is really necessary at this moment. But can I guarantee to you that it's always going to be necessary? I can't. And so then we need to have the discussion like, what is the value of a real in-person human physician? There are already studies that show that the AI generated responses in the patient portal are read as more empathetic than a doctor's response. So it really, I think it requires a little bit of self-reflection and a little bit of, thoughtfulness about kind of what we're bringing to the table. And I see Prit has something to say, which I would love to hear his thoughts.
Okay, there we go. Yeah, I think I just wanted to add on a little bit. I think what you were mentioning, like with what are they doing with the data, right? I think I was just thinking about like the privacy aspect. And I think like a couple might have been like last month, like Palantir wanted to like partner up with a couple different AI companies. I think initially it was going to be like sorry, I think it was like cloud computing, but they eventually like partnered up with OpenAI to essentially integrate it into like a lot of our government technology. So I just wonder like what are the implications of a lot of like privacy, especially with healthcare data that I think our current administration wants to access
Mm.
and to, use for like some not so great purposes, but I just feel like privacy is a huge thing because like once even like a patient putting in their own like symptoms,
Mhm.
it just goes into this huge database and like what is going to happen with that? I don't know. It's just something I've been thinking about.
Totally. I mean, I think like those of us who grew up watching the promise of social media come and go, and then, Cambridge Analytica happened, and we realized like, oh, like these companies are not necessarily operating with just our best interests at heart, has really kind of given us a point of, like, let's pause for a moment, let's be a little bit thoughtful about what might be happening with the data. And I agree 100%. Like it's very hard. With healthcare data, there are special laws that apply, which I find to slightly reassuring. But what about the data that, like my data as a doctor, when I see a patient with a tricky question and I go and I ask the question of these systems and I get an answer, how are they using that information to build and refine their models, It's a conversation worth having, I think.
And I know that we're at time, so I just want to wrap up here and give you an opportunity to close out. But thank you everyone for being here, and Dr. Miller, I'll let you close us out here.
Yeah, perfect. Well, thank you. This was such a wonderful session. The people who spoke before me. And I just want you all to kind of consider going forward, like reflect on how you're going to engage with AI differently. Are you going to advocate differently within your organization or at the governmental level? And are there different ground rules that you might develop for yourself when you're engaging with AI? So I will leave you with those questions to think about for the rest of the evening.
Okay, everyone, you can give another round of applause through the React there for our speakers. And thank you everyone for being here. Have a great night, and we'll be following up with any PowerPoint presentations with the sources. We appreciate you all here and your advocacy and interest in this topic.